Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated from USL and received a Bachelor's of Fine Arts degree. In 2006, he earned his Doctorate of Dental Surgery degree from the accredited Louisiana State University School of Dentistry in New Orleans, and he also has an advanced training in oral conscious sedation. Currently practicing from Lafayette, Louisiana. Please welcome Dr. Jason Toups. How's it going, Dr. Toups?
Oh, it's going good, brother. Good to talk to you, Shaun.
Oh, man. Thank you so much, dude. I love it, man. You and your pops have been with us forever, man, sending us lab work. And, heck, your sister...
I know, and I haven't got rid of you yet, man. I hadn't let you go. I can't get rid of you, man. You're like a bad habit. I love it.
And you got your sister in there, too, man. It's all in the family.
Yeah,
man.
yeah. We convinced her to join this crazy business, and... like I said, she picked up on the Keating addiction, and we love it, man. We love it.
Oh, that's so cool, man. I love hearing that. And you guys are buddies with Jerry Smith out there too, aren't you?
That's correct. That's who turned me on to y'all. I'm a famous Katrina senior. Hurricane Katrina hit New Orleans and shut us down our senior year, and we came up with a intern program for the seniors, and I ended up with Dr. Carl Bro, who's best friends with Jerry Smith,
yeah.
and like I said, that's why I've been using you before I became a legal dentist. So I've been bushwhacking dentistry from Keating for before I became a dentist in 2006.
Yeah, man, I love that. I do a little bushwhacking here at my dental op. I always wanted to be a dentist. I can't get those shots down, man. I gotta keep practicing, man. I practice on that grapefruit, but it's not that good now. I'm just kidding.
I got you.
We don't use any Novocaine around here. We just pump up the nitrous for them, man. Once they're
put the nitrous in the AC units, man. That's just good.
It's what we do, baby. That's why we're the happiest dental lab in the world, man.
I love it, man. I love it.
Yeah, no, that's funny. Oh, man. So, dude, I always talk a little bit about sports starting off, and I bet you're a big Saints fan, or no? Or what about those Tigers?
Big Saints fan, big Tiger fan, and I tell you what, us Southern boys, we take this a little too seriously, but the Saints are looking good. We didn't have a big draft, but I don't think we needed to. We did a big purchase on the tight end from the Raiders. He's an all-pro guy.
Okay,
it seems like the Saints got it going pretty good. Drew Brees is probably on the tail end of his career, but really, they put a good, solid team around him. Give it another good run. I know y'all Rams kind of got away with a good one last year, so we won't hold it against you. We won't bring it up. But I was at that game, and I didn't attend the game all year. I go to the one Saints game, and that happens. I was I jinxed him. I'm the black bean. I was like, oh damn.
That was such a travesty.
It's a good time.
Yeah, it really was.
But if in that stadium being closed in was so loud, obnoxious, and when that call went the wrong way, it turned from good time to like almost a mob state.
Oh, I bet.
But oh yeah, and I'm a big LSU diehard fan. So we got the returning quarterback coming back. We got a big recruiting class. ESPN's already starting to talk smack about the freshman, incoming class is going to be top notch. But college football is way more unpredictable, which makes it more fun.
Oh, heck yeah. There's nothing like going to a good college game, and it's for real. They're all playing for the love of it, man, and from the heart. And
That's right.
These NFL guys,
right.
Man, they get all the money, and they decide what plays they want to make and, how hard they want to go sometimes. But last season was pretty neat. But back to that Ram game, and they got to change something. I mean, I felt really bad when that happened. Like, how the heck can they not call that?
Right.
You got to be able to go back and change, and show something like that. But, I mean, that's just changing the history of the game in a way. But you can't have – that is just so crazy that
Not with today's technology.
Yeah.
Not with today's technology. With the cameras at every angle, we as the audience see, 10 different views.
Yeah.
You can slow it down to a freaking split second.
Exactly.
And it's like that the NFL, and I don't even see why it's an issue. NFL should have already implemented that
Yeah,
from that call. Just it should be a no-brainer. So the politics behind it is baffling.
Oh, absolutely. And if it's so blatant, I don't know if it's like one lifeline like they used to do in whatever that millionaire show. You got to have a lifeline for each team, one lifeline at least, that they can go back and do a review of something that was the whole game. I mean, if that penalty's called, they're down the 5-yard line. I think all you needed was a field goal, or I don't know what it was.
No, we were up.
You were up.
We were up because that's right. You're right. We did need. Yeah, we did need. That's right. We were setting up. That would have been a first down too.
Yeah.
And all we needed was a field goal. But man, like I said, it's one of those things. You in Louisiana, we just roll with it. We just wait for the next good time.
Oh man, if that would have been in Cleveland, man, there would have been gunshots and all sorts of. No, I probably shouldn't say that, but it would have been. Or the Raiders, man. Those damn Raiders are just like a bunch of convicts. No.
I'm telling you, man. So what's your team? Who's your college team?
I'm a college team. I'm a USC guy. My brother went to USC, so but they haven't done nothing in years. I remember with Carroll was there with the big Texas games,
right? That's right,
and all that. But you guys,
that's right, because we got Reggie Bush from y'all, yeah.
Yeah, Reggie got He was getting money in the 8th grade, from what I hear, and his parents. He was rolling in an Escalade in junior high.
I'm gonna tell you, they get caught. They get caught giving those guys money. But I mean, that's a whole other topic we can cover for us college athletes and getting paid. The colleges make so much money off these athletes.
Oh.
I don't know. They need to set up some kind of, maybe trust fund where they take some of these profits and give it to them. I don't like, paying them outright.
Yeah.
But man, they got to come up with something better than the current, process they have for these athletes. If you're going to if you're going to restrict them from going make a living in the NFL and making them stay 2 to 1 year, whatever sport they play, you're going to have to compensate these kids. This is getting ridiculous.
Absolutely. I mean, I hear just the hardships with them just eating, with all football or baseball, all these athletes, they got to go to the dorm, and a lot of them don't have cash, and you have to work your job or whatever to get by.
Right.
But with all your homework, I mean, and they're making so many billions that it's got to be a stipend or something, a little something at least, or something at the end of it all.
Ben Simmons, who was at LSU, is a prime example. They made him play a year, so he picks LSU. He goes. He's sitting there, living right above probably the poverty line. Yeah, he's in school.
Yeah.
But, I mean, you made him go to school. I mean, they made him go to college, and then he says, well, I didn't have to attend class. I'm not here for an education. I'm here because y'all made me play, one season.
Exactly.
Goes off to the NBA. So they got to do something different.
Yeah.
But there's so much money being made on the college level. It's just going to be hard to stop that.
Oh, it's crazy.
I don't know how. Yeah, it is. It is,
crazy.
Man. It is.
And that Ben Simmons is a stud. I didn't know he was from Louisiana, man. That kid is.
I don't think he's from here. He just came to. He might be from. I'm not sure where he's from, but I know he played at LSU, and then he got suspended the fall because he wasn't attending class.
Oh, okay.
Which he was like, well, I don't have to go to class.
Yeah, I'm going to NFL. I'm going to NBA, baby.
I'm going to the NBA. Yeah. So it's like they got to come up with something. They're going to have to come up with something. And then our coach got busted for. He got busted conference call or some kind of recorded voice message. The Wade for the college coach recruiting one of these basketball players, the smart kid. The smart kid back on the team.
Oh,
yeah.
Man.
So like I said, that's going to be a big stink.
I love your football coach at Ogden, dude. He was with us at SC. He's such
That's right.
How do you say it, Coach O or
Coach O? Coach O. It's Ogeron.
Ogeron
is it?
I listened to that dude talk, man, and it reminds me of the dude on Waterboy. He's like,
That's it, man. We love Coach O down here. This year was a big year for him because, man, he was in the hot seat.
He was.
We brought in the offensive coordinator from men's staff, the engineering coach. But it really turned out a very good positive year for him. And now he's got a full head of steam.
Yeah.
He's got a returning quarterback. We lost the White and the cornerback in the draft, but we lost a few good players. But we got a lot of meat coming back.
Well,
so this is gonna be a good year for us.
I hope you guys do good, man. We got to knock off the Clemsons and the Alabamas, get them out of there again, man. Hate those teams. I don't hate them. But...
He's hard to whip. I'm gonna tell you.
Yeah. Oh, that Dabo Sweeney, or what's his name? Dobo?
Yeah, Dalbo from Clemson. He's right up there. In fact, somebody was telling me yesterday, he just signed a big contract. his buyout is like phenomenal, but if he goes to Alabama, it's double.
Yeah,
Can you
that's
believe
what they
that?
said. If you get bought out, you got to pay triple. I think it's like $100 million contract the guy got, man.
Isn't that, yeah, man?
That's
A
so good.
college coach, man.
Yeah.
Can you believe that? A college coach.
That's my dream.
yeah.
You know, all my, I'm a dental tech 36 years, but I've been involved with football since I was 8 years old, and I'm 56, and football's been part of my life every day, every year of my life. And
Same here.
Same
here, brother.
I run my business like a freaking football team, dude. I swear to God. I've wrote about it in articles, and I run it. I got my offensive line. I got my running backs. I got my quarterbacks. I got my special teams. I got my front office.
And you got a good team, brother.
Yeah,
you got a good team.
And I'm the owner.
Oh, yeah, you got a good team.
I'm the owner and
you're
head
the
coach.
owner, man. But I always tell them boys, I said, anytime I get to talk to Shaun, I'm gonna tell him how good. Like I said, y'all got me like addicted, man. It's like y'all have bailed out more stuff that I've done and kept me cutting edge. It's like I tell everybody, I said, man, if I even did crappy prep work, I said Keating's lab would like help me compensate.
Heck yeah.
You know, it's like y'all make me do better because y'all such a high-end, high-end lab. Like I said, I've been with y'all. I said, I don't use any other lab. Everybody comes in here and tries to hustle my business. I'm like, look, there's two things. I said, cheap ain't good and good ain't cheap. And I don't even price shop. I was like, look, I'm praying for I pay for peace of mind.
Ah, damn.
You know, that's it, man.
That's so awesome. Let's end it, man. Let's drop the mic now. That's so cool, dude. That's a testimonial that we'll take all day long.
Oh, yeah. I mean, yeah, you can quote me on that 24/7. I said, any new dentist, anybody's lab hunting. I'm like, look, I don't lab hunt. I use Keating. I said, any mistakes that we've ever had or miscommunication gets fixed instantly. I said, it's I don't even worry about it. Like I said, I don't even think I put due dates on most of my lab scripts. I'm like,
we get them back in a couple days, baby. It's how we do it. No.
That's it, brother. That's it, man.
There ain't no messing around.
Steve, I'm pretty sure I've put about half of Steve's head full of gray hairs and implant pros. I throw him some stuff that's kooky, man. I can rattle Steve up, man.
Now, when they heard that Steve and Bob and Jim, these guys heard that I was doing Jason Toups, man, and they're like, is Dr. Brent going to be doing that? But they're talking about how just such a cool and great doctor, and you just you just crush it, dude. You're really doing some intense implant cases, and you got it down, baby. And that's probably a little Jerry Smith helping it, just rubbing off on you.
The cowboy mentality of like, look, you're gonna have to kind of think outside the box sometimes, and you're gonna end up providing for a patient some kind of service that, it's not, ideal, but it's like, let's go for it. Let's dive in there, even with, some of the ERA distal extension partials, that we'll do, or some kind of crazy implant to tooth hybrid. Yeah. Y'all never question me. It's like, hey, let's do it. Let's go. Let's get neck deep into it and fight our way through it. And man, it's working out. It's smoking it.
And the best is yet to come, baby. That's what I say, man. And we do great stuff, but that was yesterday, man. What are we doing for you today? Everyone's a new patient every day, and so we got to bring our A game every day, and we get excited. I mean, it's like the playoffs here every day, and on the end of the week, it's like the Super Bowl. It's like, all right, baby, what do we do? It's like,
I'm with you, man. In fact, that's usually when I call about every 3 months. I'm like, hey, what's something new? Like I said,
exactly.
If I'm still doing PFMs and we're not supposed to, let me know. But it's like, those KDZ line you got, man. That's sweet.
Oh,
that's some nice stuff, man. I like that. Like I said, things are delivering good.
Yeah.
Man, they look good. Yeah, when you get a second molar to look good, things are going right.
Exactly. And it's like, and the stuff's not breaking nowadays. It's like, it's kind of, we've eliminated a few variables in the last 5 years or so, and it's making it a little bit more predictable, our field, and it's a beautiful thing, man. I love dentistry, where it's at right now, where it's going, and a lot more predictable dentistry, and a lot more happy dentists out there, because it can be so damn stressful, this job, and things aren't going right, and your lab can really bring a nightmare to you. But then you got all sorts of, I'm just blown away and all the stuff a dentist has to do with their staff and to run a dental practice. There's a lot to it, man. And working with people every day, and there's some crazy people out there, dude. And it's not. I work on models, man. They don't talk back to me, and you guys are with live people. And then, that's tough.
In your line of work, I mean, you're part of it, but to be a dentist, you're kind of a little off your rocker, man. You're a little cuckoo because, man, you're dealing with a business that, you know, nothing's 100% success. Nothing you do is 100%. Everything's percent failure, percent success. And if you can't deal with that, man, you're gonna be in trouble. And
absolutely.
that's why dentists are crazy.
Yeah.
You know, we got to sit there and go, hey, man, I just did a perfect crown. Now the next thing you know, needs a root canal to work, and it snaps in half. Oh, great. And the first thing the patient says is, yeah, your crown broke. Like, no, my crown's still in there. Your tooth is in the inside. Yeah.
Or what about when the implants, man, when they don't osseointegrate, you got to put them to sleep, or it's just like, what the hell? How are we going to retrieve it, or what are we going to do? Or, oh, man. But it's
in fact,
go ahead.
That's a great point. Steve had to remake, I don't know, I think it was 3 abutment fused to crowns, and come to find out the damn implant was broken. I was like, now they're breaking the implant. So, yeah, I got that guy coming back in. I got to re-put that implant. I had to cut it out of his head.
But it's all mind over matter, man.
That's what the Good Lab's all about, man.
Yeah, hey.
That's what y'all about. I love it.
Exactly.
You're not afraid to say, let's redo it and get it fixed up. In fact, you know what? One of the things that I probably got to need to work on, I'm still taking old school impressions because I'm just too either lazy or just it's like I'm not getting digital yet. I'm gonna wait till I have to.
I probably got 80-90% of my guys still not doing it. They're still doing impressions, and I still do a ton of PFMs, and it works. And the scanning impression material, it's a neat thing. But you know what? I still love snapping impressions and everything else. And in time it will come, and it's almost as you wait a little bit longer, they're kind of getting it tweaked even better, and the prices are going down. So, I mean, I wish I would have not got on the bandwagon when the first mills came out, the CAD cams, because I bought them, and they were obsolete a year later or 2 years later, and, those are $100,000 mills, and now my mills are so robust, they're lasting for so many years, and they're a quarter of the cost, and it's just something just wait is good when it comes to materials and dentistry that aren't proven, and especially for cost.
Especially high technology stuff. It's like you need to let that stuff work your kinks out, because I had a few friends dive into that CAD cam, and I don't have one. I'm like I said, my crown on the day doesn't exist. My crown's in when Keating gives it back. That's what my crown is. That's my turnaround time.
Oh man, that's
so
awesome.
It's like I just tell everybody, say, look, I've been doing it this way. It's working. It's not broken. So just because something's cooler and newer doesn't mean it's
exactly
get rid of it all. And I guess that's my only concern with the industry, because back to removable with Jim. He's like, we're going to start 3D printing them. I'm thinking, man, I need old school. I need old school process, and Lusitone 1 and 9. And he was like, no, we don't use that. And so he's getting me on the new it's not Impact. I forgot what it's called. But the new acrylic, and I'm like, see that? Even I'm behind the 8 ball already.
No, I hear it. And those 3D printed dentures, we ain't doing them because they crap right now, man. They're crap. They're brittle. They don't look great, and I'm not going to do them until they look good. Oh, you can do them for cheaper. It ain't about that.
It ain't going to be cheaper either.
It ain't going to be. No, you can sell them for $150 a denture. It's like, well, the way these are looking, I wouldn't sell them for $100. They look horrible. And it's just, they're not horrible, but it's just a certain material they have, and until that gets better, man, I'm setting them by hand. I'm doing. Heck, I do a lot of work for the VA and stuff, and man, these VA guys, all they want is IPN teeth, and those are kind of expensive. And I haven't used an IPN teeth in years, but lately I'm looking at these things, and they're freaking beautiful. I love the contours. I love the aesthetics of them, and sometimes you just got to wait on things, especially in this field, because it's all how you handle the stress in your mind and everything. You got to really use your mind and your head on making it a great day, and not getting in over your head where you're doing products and materials that you shouldn't be doing. And so it's just something.
That's right. Now. That's right. Hey, there's too many. there's too many things that can go wrong the normal way. So trying to add technology and making it fancier and trying to think you're making it more efficient. It's like, man, you're just adding stress and just computers in general.
Yeah, I know. I'm not a computer guy.
But man,
I'm
telling you, man, I got to do an upgrade at this office, and I'm like, oh, that's another $10,000 down, that I got. Every time they say, oh, this Windows ain't working with this one, and you need a new system software. I'm like, oh God, that's always thousands.
I got several guys in my IT department. They're telling me I need this and that. It's like, I can't even turn on my computer. But the way we're going digital, you need it. But yeah, it's so freaking, and we get hacked like so many times a day. But we have all this software now, spyware, and you got guys from all these countries trying to get into all Keating dental arts. I don't know what the heck they're going to get, but it's
I don't know either. Yeah, they can hack me all they want. Okay, you want some patients' X-rays and some billing information? You can go ahead and have it.
Yeah. Just don't hit my iPhone with all my pics, man. We're gonna have to delete those from my wife pics.
Yeah. Oh Lord, they got some of those slipped in there. Huh?
No, I don't. I'm just kidding, Shannon. I don't have any on there anymore, baby. No.
Yeah, I deleted them.
Okay, well, heck, let's stop getting silly here and let's get a little dental up. So, tell me, Dr. Toups, why did you get into dentistry, and at what point did you think, I want to be a dentist?
Yeah, well, my dad's a dentist. He's the original Brent Toups. I'm the second Brent Toups. And back in 2000, let me see, back in 1998, I had a daughter, and I was an artist working in advertising design. And my dad was a dentist, and I realized that financially, I was like, this is kind of a dead end. And I did a little soul searching. I was like, Dad always told me this business was crazy, but he's raised me as a dentist, and I saw the financial success, and I saw that he gets to give the person the service. I didn't like being in advertising, so decided that I would go back to school. And Dad's support, my wife's support, took me 2 years to get into dental school. 4 years out, old guy going back to school, and like I said, 2005, 2006, that's when Katrina hit, and I was a senior. Met up with Carl Bro, and then, worked for Dad for about a year, bought Dad out, and Dad started working for me, and then he taught me a bunch of this stuff from, the ERA, the locator stuff. I started bringing in implants into the practice as soon as and like I said, that's the Jerry Smith angle, is that Jerry told me from the beginning, says, as soon as the day you graduate, he says, you start taking as much implant courses as you want. Beautiful. So having a child and, seeing, life is kind of blossom in front of you and open up some doors. I didn't want my daughter to have to, choose between a college education or, a wedding. I was like, no, you get to have both. So Dad is going to go ahead and dental up, as you say. I love it. Dental up, and let's do it. Now I have 3 daughters, so now it's 3 damn weddings. So yeah, you're going to have to cut me a deal on all these crowns, brother.
You got to pay for those weddings, don't you, huh? No.
Yeah, that's it, man. That's it. So yeah, that's how I got started. So Daddy he paved the road, and I blacktopped it because he said he had a machine going over here, and so So then I convinced my sister to do the same thing after she was having some career issues. She didn't know what she wanted to do, and she wanted to be a hygienist. And I said, look, why don't you go to school be a dentist?
How cool
like
is
you said, you can do whatever you want. You can go hardcore. You can go, lightweight. You can do whatever you want. I said, you pick your own path. You don't have to follow in what me and Dad do. Yeah. And then, I said, me bringing implants into a practice that was predominantly removable and now, fixed and everything. So that's the start of it. So that's how I got started with that.
That's a great story. Now, younger sister, older sister?
I'm the oldest. I'm the oldest of 3. My sister is the second. I have a brother in between me and her, and he's the one that owns the famous restaurant, New Orleans Toups Meadery in Toups South. He's been on Food Network. Isaac Toups. I'll plug in a little plug just in case somebody's looking that up.
We'll put that on our show notes, dude. Now we're talking, man. He's got a restaurant.
Isaac was on Food Network a few years back, and he has 2 restaurants in New Orleans. So anybody listening to this, you get to New Orleans, just think of Toups. He's got 2 restaurants. You can't go wrong. And so it'll blow you away. He'll give you the meat sweats for a week.
I'm there, dude. I'm going.
Yeah, so he's good. And then my sister's 4 years after him, and then we have another baby brother who's up in Oregon. doing his own thing too.
Yeah, how cool is
Yeah.
that, man? That's so awesome. I see you got an
Yeah.
art degree too, and that's got to help you in this field for sure.
Yeah, that sure did. In fact, that's when everybody asked me if I'm still doing art, and I was like, you wouldn't believe how much art I'm doing in the mouth. It's like,
Exactly.
from composites to crowns to dentures removal. I said it all has its own art, and it's really helped. The hand skills, the muscle memory, the working and seeing the fine details. That really helped me out in dental school. Back when I was, in art, in college and going to school, and I would flunk out or cut up, Daddy would throw me in dental lab. So see, I'm a ex lab rat myself.
I know you are, man.
pouring up models and doing all that and processing dentures. So I had a real good background in the removable part of dentistry too. So that brought a very good advantage to my dental career.
Oh, that's so huge to have that background, to bring it into fixed, to have that removable aspect, because a lot of guys have that fixed aspect, but they don't really have the concept of removable. And if you're going to be doing combo cases, man, you really kind of almost need the reverse, know more about removable than fixed, because the fix is pretty damn easy. Removable, like you're saying, you got your ERA attachments, you got so many different aspects, how intracoronal, extracoronal. I mean, there's a lot of ways to cut that prep, and there's a lot of ways of making that removable part of that fixed. And
that's right.
You just got it down, baby. And you're still young, man. You're going to be crushing even more. Tell me a little bit about your practice layout. What do you got? How many operatories and what kind of staff?
Yeah, I'll give you a quick little history. Dad had two practices. He had a little 2-chair family practice in a little town outside of Lafayette, Louisiana called Rain. Okay. And then he actually bought a denture mill in Lafayette. And then what he started realizing in the late 80s is that, hey, why don't I just work out of one place? So he took a denture mill and made it a family practice. So he did a lot of Medicaid dentures, a lot of dentures. So when I bought it, I got rid of the denture word and I just called it Toups Family Dentistry. Okay. But so it's still laid out like that. So I have 6 operatories that are open, and I'm just one dentist, and I have I've actually kind of shortened it up to where I don't work all 6 at one time. I started to get a little too thin out, and I run a bunch of hygiene. So that's how I'm laid out. I got 3 assistants. I've got 2 office managers in the front, and I have a full-time hygienist, and I have 1 part-time.
No kidding. Now, what about, because I'm getting cases from all 3 Toups. Your sister, does she work there at all, or is it another practice?
Me, Daddy, and Celeste, my sister, we all worked at the same time.
Okay.
So when y'all switched to y'all started using the ID codes on there, we didn't know. So we would just send in crowns with the same lab script, and we wasn't changing the name on it. So Dad pretty much retired probably about 2 or 3 years ago. He finally let his license go this year, so that way we can't use him. My sister's actually with Modern Dentistry. It's a chain. They might be nationwide. I'm not familiar with the corporate company, but she still might be sending y'all cases, but I don't know. She's not sending them through here. I don't know if she might be sending them.
I think she is. Bob was telling me she is, but hey, she's going to get a ton of experience there at that kind of a practice for sure. And then you never know, have her work on her chops and just get herself, dialed in, and then maybe down the line, bring her on board and she can be helping you out. Whatever.
Oh yeah, she's owner now, so now she's in the big debt. So I was like, once you become owner, it's like now you hooked. Now you're in trouble.
Yeah, that's how they get it. I love it when my techs, they have children or they buy a car or buy the home. I love it because I just know that's what happened to me. You got to work. You got that fire in the belly.
That's right. You're not going anywhere now.
That fire in the belly, man. So, dude, tell me a little bit how you're driving people to your practice, your marketing. Are you doing mailers? You doing any social media? Tell me a little bit about that.
I do the social media thing. One of my office managers, we brought in one of the advertising rep, and she was big on the Instagram, Facebook. So we do the promotions. We run through that. Word of mouth in South Louisiana is still the big deal. If you get the matriarchs of the family, you end up locking down that whole family, and that's pretty much my bread and butter. Is every person that walks in here, that person becomes an advertiser. That person becomes a referral. We did get in network with a few insurances, brought in a little extra business. I'm still just one dentist, working out of 6 chairs. So it's like I I can't take on too many patients, but we accept anything that walks through the door. I will find a way to do something for you. That's just Dad's philosophy. It's like they don't leave here without me doing something. And if I got to refer, it's a big deal. It's it's in a wisdom tooth that's down there under the neck or something like that I'm not going to go after, or like an implant that. In fact, the case y'all just did was one of my first digital X-ray cases on a doctor friend of mine, who he had just one of those S-curve lower jaws. I was like, I ain't doing that implant, doc. You going to the surgeon, and surgeon sent the scan to y'all, and I'm about to deliver that tomorrow.
Oh, you're kidding. Unbelievable. So what do you send out that you don't like doing? Are you doing endo? Are you referring those out?
Oh, yeah, I do all endo. I'm a big guy. I'm 6'4". I'm 275 pounds. So I've got these big old hands, and I can't go second molar root canal. I just did one. In fact, before I picked up the phone call, that's why I was late picking up the podcast, is that I'm trying to finish a second molar. And I was like, why am I doing this? My fingers are so big. I can't get back there. But it was kind of angled towards me, so I did it. But second molar endo, if I can't get patency, I'll refer it out. And any kind of wisdom tooth. The last time I got neck deep in wisdom tooth and had to call an oral surgeon was this Friday. And I said, I ran out of bird to cut it. And I said, that's enough horizontally impacted wisdom teeth. Yeah. And implants for sinus lifts or, complicated, extraction, surgical placement of implants. I do the easy implants. I do the easy root canals.
Good for you.
Yeah. And he said, most all pros work fixed or removable. I do myself, and not even my dentures. I set my own teeth. And you talked about those IPN teeth. I use BioBlend.
Yep.
That's my top of the line set, and then I use maybe Classic for my my inexpensive set when I have to make it. So I do all my own repairs, but rebases and relines. That's what me and Jim were talking about.
Yeah. Is
that that's why I'm gonna start using y'all pretty much for my processing. From as soon as my old guy up here in Louisiana,
yep,
gives it up.
They're far and few between, man. I'm having a hell of a time trying to get, because our removal is growing so much, and I'm trying to reach out to people, offering them the world money-wise, and they're just kind of gone. And it's almost like we got to train from within, and it takes quite a couple years to get someone trained out that is halfway decent.
Man, I feel bad for you, because I tried to hustle a few from out of school to try to train them in just removable, but it's hard to offer them the money because I'm sure all the Crown and Bridge work. The big money, is probably in the Crown and Bridge, and having somebody want to take over, removable prosthetics, it's just not a big draw. So I feel your pain, brother, because we have a dilemma down here in Louisiana.
Yeah, no, and it's everywhere, really. I mean, any good lab that really has a good removal department, they're going to be busy because they're few and far between, and they're not training them anymore. And for someone to get into the field of removable, it's a lot of acrylic, a lot of shit flying through the air, and it's just tough, man. It's a tough job, Technician is a tough job. Put your head down on a bench all day and just kind of grind it out, and your neck, your wrist. Yeah. There's a lot of little, things that kind of creep up on you after 20, 30 years. But so what about on your CE journey? What do you like? Any in particular that you're going to, or any in the past that you could give us some recommendations?
I tell you what, it's funny how Crown and Bridge. I need to come to California just to come visit and come party with y'all, and then we'll do some CE. We'll get somebody to tell me something about some.
We
some
do that
things,
here quite a. We'll get you out for sure, man.
Yeah,
I'd love to party
I don't know how
you.
good we're going to be the next day, but we'll get. We'll have a good time. But I try to take an endo course. I really try to keep my endo game. That's borderline scientific and witchcraft. Voodoo and root canals are crazy.
Yeah, they are.
I try to take a lot of big class CE. I really like to get a lot of information done. If you're going to hold my attention, you're going to have to impress me.
Yeah, I'm the same way, man. I'll lose you.
Yeah.
I had this guy come in for I got a dude that came in for a occlusion course, man, and I had about 30 people in the room, and he talked for several hours, and after about 20 minutes, man, I'm like, dude, I'm lost in this. Nothing worse than going to an occlusion freaking course, man. It's like, put your fingers on the chalkboard, dude, because it's freaking brutal. But it's just, a lot of those occlusion courses, you'll go take them, and then they're going to want you to buy a weekend course. You're going to go want to buy a $3,000 SAM articulator, and you're going to start doing a fully adjustable articulators on single units. Equilibrate the mouth. It's much worse.
Yeah, I hate to sound primitive. It's like, if you do enough removable, enough crown and bridge, you figure out occlusion, man. There's no silver bullet with this stuff, man. Each patient is different. And if you're doing this successfully for more than 10 years, you got to figure it out. You got to, you just got to, I see a lot of these young kids in here struggling with this business, and I'm like, man, I don't know. I think Dad helped pave the way.
Yeah, that old mush bite comes in handy, man. That's like the best thing. Old timer Dr. Enright up in Rhode Island taught me about that. We're doing upper lower roundies and stuff, and we have the study models to begin with, so we have that to work with, so we can kind of go off the the tissue areas and stuff like that when we get the finals, but impressions. But that a mush bite, let's just get the right overjet, let's collapse it, let's see if he's in a class 1-2 naturally, and then I can open up accordingly. I know how much 3-4 millimeters. You got the ideal curve of Speeds, curve of Wilson's, you get the compensating curve. It's all about removable, man. But you can get super scientific and do all this occlusion courses and measuring everything, and it works, but there's lots of ways to skin
I do about
cat.
3 or 4 dentures a week, so it's like, I'm gonna tell you, if the denture occlusion, you get it comfortable, you get to where you know how to work with this stuff, man. It's just it opens up all the doors, man.
It really does. It really
does, man. Yeah.
And that's why you're the MacGyver of everything. But
brother, I'm MacGyver. That's me right there. I would throw 2 pork chops in your mouth and try to get you to chew with that, man. I can make it work, brother.
Oh, I know. And you look like a middle linebacker for the LSU Tigers,
that's
baby.
Right. That's right. They don't mess with me after I deliver it. I'm like, dang, I ain't gonna piss me off,
dude. What a great podcast, Dr. Toups, man. I can't thank you enough, dude.
Man, I appreciate you talking with you, Shaun.
God bless you and your family. And, man, anything we could do ever. If you ever need help on a case when a patient's down on their luck and we got to do some heroics and stuff like that, and they're down on their luck and money, hey, we'll help and donate our services. Just let me know. You've been with us so long, and we're indebted to you so much just on all the work and just being a great guy. And thank you so much for the kind words.
Man, thank you too, Shaun, man. It's been great talking to you, and y'all keep up the good work. Tell Bob and Steve and Jim and everybody who's bailed me out of so much trouble. Tell them thank you. Tell them I started to get those shade guys a little bit better too, brother.
All right, man. Thanks again. All right, dude. Thanks again, Dr.
All right, brother.
All right, baby.
Okay, Shaun. Talk to you later.
Talk to you soon.
All right, man.
Bye-bye.
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.